Hey, everything's organized. Thanks so much for being here. I'm Alana. I'm a massage therapist, and I treat primarily people with what I love to call affectionately weird stuff. There's lots of nervous system dysregulation, lots of mental health symptoms. And as I got into my practice, I started to notice this trend that a lot of my people seemed to be hypermobile or some on that some spectrum there of hypermobility. So then I thought, well, I got to learn about this because to be honest, it's not something we learn well at massage school. Massage is pretty good at relaxing things, which is often not what hypermobile people need. So I went and did some extra training. I'm still doing some of that training, and I really wanted to put something like this together, but I was waiting for the perfect person to do it with me, which is Matt. Matt's here now. Do you want to introduce yourself and tell us a little bit about what you do?
Sure. So I'm Matt. I'm a chiropractor here. Similar to Alana, didn't have a ton of experience in hypermobility. Um, have different ways of treating it. So like her, I've done a little bit more research, a little bit more work, and kind of exploring and finding some new ways to help people. So she's been a big help with that, and I would like to share it with you.
Yeah. So tonight we're going to cover a little bit about how hypermobility presents. It is a huge spectrum. We're going to talk about how this impacts your nervous system and give you some tools to hopefully manage some of that extra nervous system load. We're going to introduce Donald from the UC in a few minutes, who is doing a study on hypermobility, and he'll tell you about that in a moment. And we're going to do some physical training tools as well, because obviously we're manual therapists and that's our main scope and our expertise. So we are happy to have questions. I will say the presentation is being recorded, so don't say anything that you don't want out there in the world, because I expect this to go viral once it's out there. So, people will be, seeing this. Okay, so let's talk a little bit about hypermobility. It is absolutely a spectrum. So for some of you, you have a few joints that move a little farther than the normal range, and maybe you deal with some chronic muscle tension around those joints. Maybe you're a little bit more injury prone. Others of you might be farther down that spectrum and you're dealing with chronic pain, chronic fatigue, a lot of nervous system dysregulation, a lot of autonomic dysfunction. And this is the sort of the mystery around hypermobility, is it can be different for every person, and it can be different for one person one day to the next, to the next, to the next. And so I thought I'd start by sharing a little bit of my own experience with hypermobility. I did not know I was hypermobile until I was in my 30s. And I was at a yoga class, and the yoga teacher said, Alana, your elbows are hyperextending. And I was like, what are you talking about? And she said, they're not straight. And I said, yeah, they are. And then she took a picture and showed me my elbows. And I said, ew. And she says, no, it's not gross. It's just, and it was a yoga class. So she's like, everything is perfect and you are perfect just as you are. And it's just important that you're here, but you might hurt yourself if you keep doing that. And I said, okay, let's just go ahead and call that incorrect as a form and help me correct that. And then when I went to massage school, we were doing different, postural sort of conditions. And one of the students who was ahead of me said, do you know you have hyperlordosis, which is, extra curvature at your low back? And I said, no, I guess I don't look at myself in the mirror from that angle very often. And so then she sort of worked with me and helped me correct that. And then I started to pay much more attention to what was going on. So my former sort of normal standing posture is here. Feel free to stand up if you can't see. So my knees hyperextend and my pelvis is way forward like this. So I was getting a lot of sort of chronic tension and discomfort at my low back. I used to be a wilderness first aid instructor, and I would stand on concrete floors for, 7 to 8 hours. And at the end of the day, I'd be really sore. And I didn't know why. And so for me, with this much change, with my knees in what is actually a straight position and my hips in a neutral position, my low back tension is gone, and my chronic hamstring tension, I've injured this hamstring pretty significantly, is not a thing anymore. I used to be one of those people that I would stretch my hamstrings all the time and never get any change from it. But even though I had crazy tight hamstrings, I've always been able to put my hands flat on the floor. So, people would treat me and say, wow, you're so tight. And I'd say, yeah, watch this. And I would drop into this squat, right? With no, that's not hard for me at all. But with the way my body presents to someone else's hands. They're like, you shouldn't be able to do that. So then I started to learn more about how joints work and how muscles work around them and how much impact this has on the nervous system. So I have a few things on that hypermobile spectrum, but I'm nowhere near the chronic pain, chronic fatigue. There's a lot of things that I don't have to deal with. Though, as I started down this journey a little bit, all of a sudden one day I was laying on the floor doing some mobility work, and I went, I wonder if this connects to gallbladder dysfunction. I had gallstones when I was 7, and I had my gallbladder removed when I was 14. And so I went, I got to look that up. So sure enough, I went online, and yes, early gallbladder problems correlate to hypermobility. I have no way of knowing whether I have dysfunctional collagen or had dysfunctional collagen in my gallbladder. I don't even have it anymore, so no testing there. But it was just one of those things that I went, oh, okay, that's weird. So then I started paying a lot more attention. I was just telling Dad I was at a yoga class on the weekend, and I haven't been to yoga in at least 5 years, but a friend of mine was playing guitar at this yoga class, and it was a relaxing one. And I was like, oh, I'm going to go to this relaxing yoga class. It was so hard on my body because it was a lot of like low back twisting and like a lot of curve at the low back and then staying there for 5 minutes. And I went, this feels terrible for me. So I was moving the whole time. And I thought, how many other people are sitting in the class going, I should feel better because I'm at yoga and that's a good thing to do. But then I wake up in the next day and feel bad. Same with massage. I started asking people, do you ever feel worse after massage? And when people say, yeah, sometimes I had somebody say, oh, I won't be cooking supper tonight. Like I made sure I had leftovers because there's no way I could go home and have like normal function. And I went, okay, why are you going for massage? Like to me, that's like, I'm not going to do that anymore. And she said, well, it's good for me, right? I was like, is it? Like, let's find a way to make it good for you. But right now it doesn't sound like it is. So that's really, how we want to work is manual therapy can be incredibly helpful for hypermobile people if it's done well and correctly and with a lot of like, how does this actually feel for you and how does it feel for you today? Right. Any questions about any of that stuff? Okay, so we have asymptomatic hypermobility. Up to 20% of the population has some hypermobility. For the vast majority of people, they don't have any problems with it. Maybe they're a little bit tight around that joint, but they might just have a joint or a couple of joints that move too far and they've never noticed any problems with it. The causes for that can be anything. They can be, I've injured this ankle a bunch of times and the ligaments are all blown and they're just not holding things together. So that one ankle is hypermobile. It could be the joint is shallow. So instead of having like a nice deep cup and the bone is sitting in this, maybe the joint is just a little bit shallower. It could be there's some problem with the connective tissue, but also maybe not. So lots of potential causes for that. When we get down the road to our symptomatic hypermobility conditions, there are genetic conditions that are inheritable and they typically impact the collagen. So I don't know how much you know about collagen or connective tissue. Imagine this is like the scaffolding that holds the body together. It should be what keeps joints in place, what holds bones, bone into the socket of that joint and held in place by that tissue. But we have collagen all over the place in the body, not just in ligaments and tendons and muscles. So hypermobility can affect skin, heart, digestion, bowel, bladder, genital organs. Like there are 13 different types of collagen in the body, and coincidentally 13 different types of Ehlers-Danlos syndrome, which is one of the presentations of a genetic condition that will make you hypermobile. Within that spectrum, you could have a diagnosis of Ehlers-Danlos syndrome and be very, very, very different in presentation from someone else who has the same diagnosis as you do. So it is a very difficult thing to treat. It's a very difficult thing to get diagnosed with. And for us, it's one of the things that we just really need so much feedback from our patients to make sure that what we're doing is actually doing what we think it is for you or what we intended to do for you. And before we get too much farther down this line, I do want to say too, this is a very difficult conversation to have as a practitioner. Talking to people who have chronic pain about chronic pain is very difficult to do because we don't know where you are tonight. We don't know what your day has been like. We don't know how fragile you feel right now. And when we start talking about things, the things that we say with a certain intention might not be what you hear. So I want to make sort of an overall apology. If you feel like offended or insulted or dismissed at all tonight, please know that that's not our intention. Also, please know that we're comfortable having that conversation. I've had conversations with people on my massage table where I say something and I feel their body go, not interested in that conversation. I go, hey, how did that land for you? Like, what did you just hear me say? And then they'll tell me, or they'll just say, you know what? I have just talked to so many people about my pain. I don't want to talk about it anymore. Like, that's okay. Like, that's 100% okay. You can come for a massage. We don't have to try and solve the problems. And again, like on that note, we strongly believe that dealing with some physical presentations of these conditions can impact other signs and symptoms in a positive way. I had somebody on my table today who she's not hypermobile, but she's been dealing with chronic pain for a very long time. And she's made a couple of changes. There's been some belief repatterning, and this is really going to embarrass Matt, but I'm going to say it anyway. She saw Matt and her like decades of chronic pain is 80% better. Probably because he listened to her and let her have a conversation and told her that actually you're incredibly strong. Like your back is healthy and strong. And I can tell that because I ran all these tests and they're all coming back negative, and you can do all of these amazing things without preventing pain. So she's like, I'm better. I can do all the things that I want to do. And one of the things she said was, when I go to bend down to touch my toes or tie my shoes, and I feel myself do all of those little protective things to protect my back, I remind myself, actually, I don't need to do that. My back is strong. And then I tie my shoes and I don't have pain. Okay, so awesome success story. We've seen that a bunch of times. Just because it happened for her does not mean it's going to happen for the next person who presents exactly like she does. And that journey of, where are you on your relationship to hypermobility and how significant it is, and how many times you've been told, well, if you just did such and such, then you wouldn't hurt so much. We just want to be sensitive to that. Okay. Okay. Why don't you tell us about your study?
Sounds good.
I'll come on up, come and stand up here so that the people online can see you.
Well, hello, my name's Donald. I really appreciate the chance to be here tonight, and I really think this is an excellent event, and that we should be doing a lot more conversations like this, so I appreciate that. And yeah, I'm here to kind of share a bit about the work we're doing over at U of C, and kind of sharing inviting you to participate, or even just learn more about the study, even just contact us and maybe see where our studies go in the future. So my name's Donald. I said that 3 times already, but I'm a PhD student over at University of Calgary. Our lab is the Better Mobility Lab, and we focus a lot on people with hypermobility, people using mobility aids. Our whole stick is to kind of get people moving and help them move better. And so the study that I'm here to talk about tonight, I actually have handouts I can pass out too, is looking specifically at individuals with hypermobility, specifically female with hypermobility. You can pass that if you want to take one and pass it along, kind of thing. So a lot of patients, this study comes from clinical practice. I work with physicians at U of C who see patients with Ehlers-Danlos syndrome, with hypermobile spectrum disorders, and they see predominantly female patients. And a lot of these females would also find that their symptoms would get worse, or they'd have more frequent injuries around times of life when hormones were changing. So whether that was puberty, pregnancy, the menstrual cycle, or even during menopause. And so we want to look at, well, could hormonal changes potentially be involved in the severity of the condition and in how you're feeling? And so our whole study is looking at essentially in the population of of individuals who are experiencing a menstrual cycle, how are your changes in hormones affecting your joints, your joint function, your muscle strength, as well as your symptoms and your quality of life, to see if there is a correlation there. So if there is, we can then look into what do we do about that? So that's kind of a quick 5-minute spiel about the work we do. I know I talk really fast. I apologize for that. But if you're interested in whether it's that study or you've been learning about the other studies that we're doing, feel free to reach out to us on that forum there. And we're always happy to talk with people. So again, I appreciate the chance to be here and speak, and looking forward to the rest of the conversation.
What is your hypothesis going into the study?
So the hypothesis is based on, I'm going to try to do this succinctly. The hypothesis is based on literature in female athletes. And so we know female athletes are sometimes up to an 8 times risk of a knee injury, depending on where you read the stats. And there was a bunch of research maybe 20 years ago looking at if this could be hormone related, because it was mostly in women. And so these studies looking at the menstrual cycle found that times when estrogen was higher, your joint laxity or movement of the knee joint was actually higher at that time as well. And this is when they were more likely to get injured. And so we wanted to see if that same hypothesis is true in hypermobile population. We have these changes in symptoms for some individuals. We have these changes in joint function maybe. But the interesting thing is that was only in half their population, or half the samples that were studied, or even half the studies reported that. So I think it's not everybody that has those changes, but if you're someone who maybe predisposed to those hormonal changes affecting your joints, affecting your symptoms. Okay, if we can identify that, we can now maybe do more tailored treatment towards you or more tailored interventions, right? And so the key is, okay, how do I identify that? And that's kind of where this study comes in, is to describe that in the first place. So I think there is changes for maybe half of the population if we're going off the previous numbers in athletes, but there remains to be seen. So that's what we hope to discover.
For those of you who live with hypermobility and have dysregulation, what's your initial instinct? Like, if you had to check a yes or no box, do hormones impact hypermobile presentations? Yeah, I'm gonna put my slot in that as well. Hormones are neurotransmitters, they affect neurotransmitters, like, there's so much connection there. It's a very cool premise for a study, and I love the fact that more specific science for hypermobile populations is happening. That's great. And Donald plans to hang around till the end, so if you have questions for him or you want to learn more about the Better Mobility Lab, he'll be here at the end of the presentation. And this will surprise no one at this point, but I lost my outline of what we're doing. Are you next? Oh, you're next, right? Yeah, okay. That's
Yeah, good
next.
to meet everybody.
Yeah. Oh, yeah, that one right there. Thanks. Okay. See.
Okay,
Yeah.
so again, I'm Matt. So Alana's kind of discussed some of the stuff that goes along with hypermobility. I'm going to talk a little bit more about physical training and how that can help with the chronic pain, both movement control. So when we talk about hypermobility, it means a person's joint moves beyond what is considered a more healthy range. Now, flexibility might sound like a good thing. In some cases, it is, but it often comes with a cost. Reduced joint stability. This puts increased strain on the muscles, ligaments, and joints. This results, like Donald was saying, in a higher risk for injury or chronic pain. So there are two main challenges that people with hypermobility face on a regular basis. First one, chronic pain. This can come from unstable joints, muscle fatigue, or repetitive strain. When joints lack that natural stiffness, the body ends up compensating in a few different ways. One, it may lock the joint in an end range position, putting some stress on that joint capsule, like they were talking about earlier. Another way it may compensate is by holding it at that end range and stretching out that ligament. We're continuing to put more stress on that joint, causing more stretching, making you more hypermobile. The joint's not designed to handle this kind of stress long term. So as things overstretch, this can lead to discomfort, tension, and pain. Second thing that is involved is poor movement control. Hypermobility is often associated with reduced proprioception. Proprioception is your body's ability to tell where it is in space, how much it's moving. The system works through a network of special cells called proprioceptors. Think of these cells as tiny sensors in your muscles, tendons, and joints. These sensors constantly detect change in the body, set signals to the brain. For example, if you were to close your eyes and then bend your knee, you'd have some sort of idea how much you're bending, how much further you can bend, where to stop. After you bend your knee, with that proprioception dysfunction and people with hypermobility, it can get thrown off, and that between the brain and body can get a little bit disconnected. So this information that the proprioceptors send to your brain, and it coordinates and kind of fine tunes your movement, adjusting your posture and keeping you in that stable range. So again, when it's not sending that clear information, it gets kind of thrown off and can impact the way you move. Another aspect I would like to discuss is why the typical or regular approach to chiropractic or treatment doesn't always work for those with hypermobility. For a lot of non-hypermobile people, the approach to care is pretty similar. We focus on reducing pain, increasing range of motion, stretching, and strengthening. Sometimes this can work in hypermobile people, but oftentimes it misses the root cause, which is that joint stability, and it can even make symptoms worse. So when it ignores the joint stability, they already have too much flexibility. If we continue to stretch it, it's continuing to make that problem worse. Another thing that most treatment relies on is passive treatment, which in some cases is great and it can be helpful short term, but it's not going to fix the long-term problem. For hypermobile people, they need active strategies to retrain their motor control, muscle balance, so they can keep that joint in a stable range. Another thing that rehab doesn't necessarily prioritize is how someone moves. Most of the time it's focused on getting people back moving, not necessarily how they move. People with hypermobility often have this impaired proprioception and poor joint awareness. So without retraining the joint how to move properly, it can put more damage and more stress on the joint by just increasing the way it's moving. Kind of what I've wrapped up before is the one size fit all doesn't necessarily work for hypermobile people. Everybody presents on a spectrum and it can be different. It's kind of individualized the way we approach each person. So without addressing the unique needs, especially on active stability, proprioceptive training, and motor control, it can become more and more difficult for these people to feel like they're getting relief and long-lasting relief.
Yeah. So I'm curious, and you don't have to answer this if you don't want to. Has anyone in the room experienced a treatment by physio, chiro, massage, acupuncture, anything like that, and felt significantly worse after? Anybody felt like there just wasn't much change? Right? I would go to treatments like and come up being like, that felt nice, but I don't feel any different. Right. So that's where, when we understand a little bit more about the proprioceptive system and how the motor control is happening and what the nervous system is doing, we can get better results. And one thing that we care about a lot, again, is like, is this actually better for you? Right. So often I'll talk to people at the end of a treatment, I'll say, so better, same, or worse? Because sometimes you get off the table and you're like, I felt great when I was laying down, but then I got up and I felt like garbage. So if that's the case, we got to find a way to work differently. Or maybe I'm not the right therapist for you. And then we got to find somebody who could do that better. Yeah. Okay. So other symptoms. When we have hypermobility that is a more significant, more symptomatic, probably coming from some changes to the collagen structure in the body. These are some of the other common symptoms, and there are more than this, but stomach, digestive problems. So things like, it often gets diagnosed as irritable bowel syndrome. And then the techniques that normally work for IBS don't work, because probably for a hypermobile person, the food's just not moving. So it's just hanging out there and there's more bacteria and more fermentation and or constipation or diarrhea or both. And I was really struggling today. I went to write poor proprioception and just wrote poop on the board, which wasn't even like I'd already covered that. Headache and migraine, common with hypermobility, poor proprioception. So again, that's just this, like, does anyone feel clumsier than they should be? Like you walk into things, run into things, drop things. I am especially clumsy and more clumsy when I'm stressed. That happens often for me. Yeah, all the mystery bruises. But bladder and bowel problems, that's a common one. Nervous system dysfunction. So this can present in a variety of ways. This can present as POTS, positional orthostatic tachycardia syndrome. So this is you sitting down, you stand up, you get dizzy, lightheaded, and your heart rate actually raises by a significant value. There's a diagnostic criteria there. I think it's 20 or 30 beats. Do you know?
About that.
Yeah, but you could have, like, that happens to me every time I stand up, but I don't have enough of a heart rate jump to qualify as officially POTS, but you can still benefit from the strategies that people who have POTS do. It can also be difficulty thermoregulating, flushing, so lots of redness of the skin is quite common. Easy bruising, this is one of those people will go, I have no idea where that bruise came from, don't remember getting it. Poor wound healing, so things just take a very long time to heal, or they heal in strange ways. So many people here are like, yep, check marks. So it takes a long time, or you end up with weird scars that don't make a lot of sense. Chronic pain and chronic fatigue. So these are massive ones, right? This is like the chronic fatigue. This is one that I ask people about a lot. What's your fatigue level like? Because that's something that your body is just working so much harder. Soft, stretchy skin. So people often say like, oh, your skin's so beautiful. It's so soft. And yeah, awesome. It's probably because the collagen is defective, but I'm glad I have nice skin. And MCAS, which is mast cell activation syndrome, which typically presents with very significant allergy type presentations, like somebody, runs their fingers down your arm and you get a big red welt from it, very itchy, things like that. You can have reactions to quite a lot of things. And this is just a little bit of the symptoms that can come along with hypermobility. One of the other big ones, while we're talking about nervous system dysregulation. Oh, I wanted to show you this first. Has anyone seen the spider? Yes. Have you guys seen this? That's awesome. The spider is a very cool tool. And I'm just going to grab a colored marker here. I had this drawn at home and my kid was like, this is the spider web of anxiety and depression. Like, this is terrible. I don't want to be any part of this. So you could be somebody who has, this is neuromuscular skeletal problems, right? You could be somebody who has very high, that's a terrible marker. Oh, there's a whole bunch of markers. There's a bunch of really good ones back here. Meanwhile, I'm using whiteboard markers and hoping no one notices. Nice. Okay, so very high musculoskeletal, let's say you've got high pain, but your fatigue's not too bad. Your GI stuff, gastrointestinal, not too bad, but maybe you have weird heart palpitations or actually serious heart conditions. The depression's not bad, but the anxiety is really high and you don't have much of the, bowel, bladder, genital stuff. So your spider web, your spider looks like this, right? And this could be different for you next week. Okay. And then on the other hand, you could have somebody who has like very significant fatigue. The pain's not awful. Musculoskeletal feels pretty stable, but they have like pelvic organ prolapse and the anxiety is okay, but depression is not great. And the heart stuff is non-existent and GI stuff. Oh, I've already done GI, right? So their spider looks like that. Spider web. And again, this can be different based on a different day of flare up. And as Donald was talking about with hormones and these changes around like puberty or menopause or pregnancy, it's common for hypermobile people to feel very stable until something else happens. Like COVID, for example, was pretty rough on the hypermobile population. It could be a physical trauma. It could be high psychological stress. And it's like everything was fine. And then now all of a sudden, I have all of these symptoms that are now seemingly to compound one another. So the spider is a very good tool for you tracking your own symptoms or to show up if you've got medical teams or medical providers to say like, this is what's going on for me today. And if people even have a sense of what the spider looks like, then they can go like, yeah, okay, there's where we're seeing most of our symptoms right now. Okay. I left you a page in case you needed to write anything. Okay, so we're going to talk a little bit about nervous system dysregulation and anxiety, because anxiety is a correlating factor in hypermobile populations. And you can have anxiety and zero hypermobility, and you can have hypermobility and zero anxiety, of course, but there is a very strong correlation here, a very strong connection. So from a sort of some of you have heard this before because you've seen me for treatment. If you're not familiar with the threat bucket concept, I really like this for talking about how the nervous system has a finite ability to manage what's going on. So you imagine that you have a bucket, and because I'm a manual therapist, I start with physical stuff, right? That's my scope of practice. So we put all of your injuries in the bucket, anything that your nervous system would remember, fractures, multiple injuries to the same joint, car accidents, concussions, right? Let's crank that up for concussions. And then let's put some other physical stressors in there. How well are you sleeping these days? Have you changed medications lately? What's the nutrition like? What's the hydration like? We've got more stressors. Potentially some of those are not stressors, right? If you're sleeping great, then that takes volume out. But then we're not just physical beings. So we put everything else in there, the life, the work, the relationships, the, et cetera, et cetera. Once the bucket gets close to the rim, anything can be the thing that makes that spill over the edge. And if it spills over the edge, we get symptoms. And those symptoms could be a flare-up of pain. They could be an old injury that hasn't been a problem, now suddenly seems to be a problem again. You could be clumsier. You could be, if you're me, more irritable, less patient, and more resentful. That's always my cue. If someone asks me something reasonable and I'm like, I have to go all the way downstairs to get that, that's really then like, I'm not okay. That seems like a me problem as opposed to, the request. So we watch for these symptoms and then we go, okay, so the nervous system can only manage so much. And once it hits that tipping point, it can continue to spill. The good news is anything we can do that takes volume out of this bucket leaves room for the nervous system to manage other stuff. And it shifts us more towards feeling safe in our nervous systems instead of threatened in our nervous systems. So when we train our proprioception, or we get less pain in our bodies because we've moved better, or we've seen somebody for treatment, or we're taking a better pain medication, this volume can come down. And that leaves the nervous system more space to handle other things. So hypermobility is a threat in your threat bucket. Your brain does not know where your joints are. And it doesn't trust your joints, and your joints feel scary and threatening because they're never where they're supposed to be, and they're always causing pain or tension or a threat signal from the body. So if we can learn to train our joints to feel more stable, and for some of us this is simple, and for others it is really not simple and it takes a long time, but if we can add more safety around the joints, the nervous system feels more comfortable in the body, trusts the body less. We've just taken a chunk of stuff out of this threat bucket. Does that make sense? Okay, so that's sort of the lens we're using to say hypermobility is more than just movable joints or weird collagen. It's more than just your chronic pain and fatigue. There's actual interactions with the nervous system as a whole. And when we change one thing, we can change everything. So there is a very strong and very evidence-based connection between anxiety and hypermobility. And this happens through a variety of ways and probably more ways that we don't know about yet. So a big one here is this nervous system dysregulation. So hypermobility sends us more towards our stress zone, that fight or flight response. And we can have things like heart palpitations, increased breathing rates, more muscle tension, more pain because we're more towards that stress zone. That then compounds. We can have increased interoception. So interoception is our knowledge of our inside of our body. What does my body feel like? And things as simple as, am I hungry or thirsty? But people who have hypermobility tend to have very high interoception. Every time something feels a little weird. And when something feels a little weird, it's a threat signal to your brain saying, what is that? What's happening? Why is that happening? And the why is it happening question is almost never answered for you, especially if you don't know that you're hypermobile, because the why it's happening is, there's a problem with your collagen and it's affecting an organ or it's affecting a joint or it's affecting something else, or you've got this, positional orthostatic tachycardia, whatever's going on, but the interoception is so high that you know it every single time something shifts a little bit. So having good interoception can be a good thing, but in this case, it can be an anxiety producer because we're always in that space of our body not feeling safe. Sorry, that's terrible writing. That says neurocircuitry. So there's actual changes in structures like the amygdala, which is where that's our fear center. That's where the stress response starts. So the brain is so much more interconnected than we sort of have imagined in the past. And hypermobile people tend to have a hyperactive amygdala, for example, amongst many other things. And then genetics comes into play for this as well. So it is a genetic condition. So it's possible that there is an actual genetic connection between the anxiety presentation and the hypermobile presentation. We don't know that yet, but there's definitely a strong genetic link to both of these things, anxiety and hypermobility. Questions or comments about that? It's always a little bit weird when you go, oh, like my brain is actually different than other people's brains are. And there's good reasons for that. That was much faster than you thought it was going to be, right?
Yes.
Okay, on to the physical training.
Okay, so I'm going to talk a little bit more about physical training, and we're going to go through some examples. So one of the best ways to kind of break this vicious cycle between pain causing people to move less, muscles get weaker, causes more pain, go through this cycle through targeted physical training. When I say training, I don't just mean getting stronger. Training the smarter, build stability, unnecessary strength. Why does physical training work? First of all, it helps build that active joint stability. Muscles can help stabilize the joint through range of motion. Or a lax, look at lax. Again, helps retrain that proprioception and working, improving the ability to movement. And it helps reduce mechanical stress on the joints. So standing in line at a grocery store and move your knees out. By training that, we can help limit that stress. Okay, so the first example we're gonna do with Alana as the demo here is we're going to do balance on a single leg stand.
So you know why I was fast? I forgot my nervous system regulation tools.
Okay.
But we're gonna do that at the end. That'll be a good way to.
Okay,
Oh, man, anyone else dysregulated? Just me? Okay, all right.
okay, so this would be an example of something that we're looking at, kind of an appointment or treatment. So I'm gonna get you to stand on one leg with your eyes open. Everybody's gonna see how her balance is today, how full that red bucket is.
Right.
Okay, check the other side as well. Okay, not too bad. So now if we add a little bit more threat to that thread bucket, we're gonna get her to close her eyes.
I win.
Okay. Still pretty good. But a little bit more
Don't speak
unstable.
too soon, okay? This is typically my good leg.
Okay, so a little bit unbalanced. So one simple thing we could do for this is we're just gonna have her roll her foot with a lacrosse ball or golf ball. I roll to the bottom of her foot, she's stimulating some of these proprioceptors, essential for balance and awareness. It allows for this clear information being sent from the ankle up through the spine to the brain. Activates, also wakes up some of the muscles in her foot that help with stability. So doing something that's rolling the bottom of your foot can help with their balance.
Anybody ever tried this?
No.
Let's see.
Let's see if she does.
All right,
Okay, so again, very quick. I'd say that's better. How
feels
does that feel
better.
to you?
Yeah, it's less, it's still, I'm still doing lots of adjustment, but yeah, that feels more stable and less fatiguing on my shins.
Good, okay. So another thing we could do, so for some people, this isn't gonna work. It's may make no difference, it may make them a little less stable. There's other things we could do. Example of this is we're gonna go through stabilization. So if you're gonna do that star kind of lateral lunge
Okay.
movement that we've done before. So just by doing a little bit of activation, helping to wake up those muscles surrounding the ankle, surrounding the knee, surrounding the hip. Pull on for balance.
When we tested this earlier in the week, I rolled my feet and got significantly worse.
Yes.
I don't know why. That's right, that's right. It's the pressure. Yeah,
Yeah.
that made me better. Yeah. And when I was doing that, I'll just test this, like, I rolled my feet and then I went to balance them again and I said, it's worse and it's more fatiguing. I could feel it in my hip. So then I was like, let's do some stability and see if that makes it.
So again, like Alana was talking about, every day can be different. That balance looks really good. to
This
me.
feels, that feels much better. Yeah, less, less.
Every day can be different, person can be different. Part of it's kind of exploring and find what works for you. Tools by themselves at home.
This is also a tool I use a lot for myself, so it's something that I know. So this thing that works great for me, and then you try and you're like, oh, it's terrible. And just go, okay, that's fine. Yeah, that's better. This shin is like really fatigued. This like skin anterior is gross. Yeah.
Okay,
Okay,
okay. Let's go through another example. So let's do the Kozak squat.
okay, great, yeah, okay.
So this is a movement Alana's done lots of times, sometimes has problems with. So those of you who can't see, a little bit unstable when rolling onto this foot, kind of watching for the heel coming off the ground.
That's hard getting up on both sides, yeah.
Okay. So another simple sort of thing we can do for this is just twisting your ankle in the air. Again, so you could do the seated, you could do it standing, you're just kind of twisting your ankle
Oh, yeah, I
around.
was gonna do the sitting down, so I would.
So just by twisting your ankle around various movements, one thing I really like to do is kind of like write the alphabet. Move through joints in a bunch of different motions, kind of in ways that it doesn't normally move.
I write other stuff,
Okay.
the alphabet.
So similar to this, activating the proprioceptors, ankle helps protect with the brain protective parting. So as mentioned before, people have decreased proprioception. Sometimes the brain perceives this as a threat and it causes them to spasm down. Like in a where she kept stretching her hamstrings, but nothing was training, or nothing was changing. That's because the brain is perceiving it as threat, they tightening things up. I don't know if everybody can see, but her ankle and her heel is staying a lot closer to the floor.
And I'm not faking this, like this is legitimately this much easier. Cause normally when I do this, I feel it all in the front of my shin. Like I can't activate that muscle well enough. So that's what I get from increased proprioception.
Yeah. That's just simply because the brain and body can't tell where it accurately is in space. So it protects itself by guarding down, limiting her heel from getting close to the ground. Okay, good?
Yeah.
Okay. Another simple one we're going to go through is standing to sitting in chair. So oftentimes we see, not just in hypermobile people, but a lot of people is when they go to sit down into a chair, particularly at the end of a long day, they kind of just collapse, they kind of fall into the chair. This can be due to things like muscle fatigue, but also that proprioception that the body can't really tell where it is in space. So when she's falling down, it's putting stress on the joints, on the ligaments, and it's just general body unawareness and kind of just shutting everything off. So a simple thing that you could do throughout the day is when you go to sit down, just do it nice and slow, controlled, focusing by leaning forward and slowly sitting back. What this is doing, it's going to help train your body in a simple and functional way that can be used in other areas like squats or different squats, yoga. Just moving through very simple thing that you do many times per day that you can help train it. It doesn't have to be these big changes where you're going to the gym and you're going for treatment all the time. Simple things like this. On the other end, we often see
Come here, come. You wanna go out today?
There we go.
Okay. Another thing we see with people when they're going from sitting to standing is they kind of throw themselves forward, kind of lurch forward. So
Do they
Alana,
get up like that? Or like on the knees and grunting?
so Alana's been training on this, so she hasn't done it, but lots of people, especially with hypermobility, when they go to do that, they end up snapping their knees into extension to help them stand all the way up.
Yeah.
Again, this is putting more stress on your knee and on that joint capsule. Same thing as sitting down, just going through this movement nice and slow is going to help train the proprioception. It helps train for some strength that will help you in day-to-day life and help you just grow older from simple things like sitting down and getting up. So a cue just for sitting up is just kind of lean yourself forward, activate your core, then feel you press through your legs. Something very simple.
Can I show them my getting up off the massage table?
Absolutely.
Some of you have seen this, okay? And if you haven't, this is my version of the Reese Witherspoon bend and snap from Legally Blonde, right? I'm not going to do that. You guys know that. I'm sure you do. If you haven't, that's your homework. Go watch Legally Blonde. So after a massage, often people are like, oh, everything's feeling really good. And then they get up off the table and everything goes, right? Your nervous system's like, I had that tight for a reason. And you went and like relaxed and now I don't feel safe anymore. So especially at the low back, if I've been working on people's low backs, I have them get up with what I call the bend and roll instead of the bend and snap. So I'll have people, position themselves so they're sitting on the edge of the massage table, feet are flat on the floor, and then they roll down as far as it feels comfortable. And you might even want to roll like a couple of times because movement is usually good. And then hands on your feet, stand up butt first and roll it. And that reduces back spasms getting off my table by 84%.
And like we
Science.
talked about, some people that helps a ton, some
Yeah.
people that flares it up more. So again, it's individualized. I might go home and try this and say, that made my back way worse. And that movement that might not be for you.
Yeah, stop doing that. Yeah. But that's, I think, a big thing. You have to have permission to not do something that your therapist tells you that feels bad for you. But sometimes people are like, well, I should keep doing it. And sometimes you keep doing it and it does get better. But there's a lot of people out there taking our advice, which we think is helpful. And it worked for the other 8 hypermobile people we treated. And then they just keep doing it. And then they don't tell us that it feels bad. So if you're ever seeing us for treatment and we tell you to do something and it feels like garbage, tell us.
There's lots of other tools and other techniques we can use. Okay, another simple one, we've kind of touched on it a little bit already. Hypermobile people, general, when they're standing in line at a store, like Alana was talking about, they stand in that. You're showing it, exactly. Kind of locking out that joint. It's putting stress on the joint capsule and it's taking the muscle, the active muscles out of it. So they're not really working. They can just relax. While this may seem good, it's putting more stress on that joint capsule. By just a few simple cues and being mindful of this. So all I want you to think about is just having soft knees. Some people that helps, just having a little slight bend in your knee. Some people that they need a little bit more. Another thing I find is people when they have that extended knee, they're putting a lot of weight in their heel. You just lean forward a little bit, it's very difficult to stand up straight without bending your knees.
That's true.
So you can follow.
Yeah.
Exactly. So when we use those muscles that are stabilizing the knee, that's going to help train them. It's going to help stabilize the knee in that active and dynamic way instead of just locking everything out because it's hard. Another example of this, Alana also touched on, was her elbows in yoga. I'm not going to make her get down on the floor to show this, but if you put your elbows out, they were extended.
Mine are not extreme at rest, but when I load them, they like I'm too far this way and I'm too far that way.
And lots of times we see people that love yoga and they go to yoga all the time. They say, I'll get in this position and I feel like I can hold it forever. It doesn't feel like I'm doing anything. Doesn't feel like anything's activating. It just feels like nothing, for lack of a better word. Same sort of thing. You're just locking out your joint, taking the active muscle out of it. So simply softening the elbows is going to help activate those stabilizing muscles around the elbows that can be used for other activities and help promote that stability. Anything you want to add with that in terms of
It makes
yoga?
yoga way harder.
It makes yoga much better.
All of a sudden, you're like, I'm so good at yoga. Look how I can get into all these positions. You try and take it back by 10%, and it's like, damn, now I'm working. But that's where you want to be at, and not all the time, right? We in and out of things. So you're gonna, if you try this stuff, you're gonna go, wow, I went to this presentation and my life just got harder. But as we build endurance and stability, you get less pain and more. And it's not even that the muscle is weak, it's that we're using it for the wrong things, or we're using it all day long, or the rest of the stability muscles aren't working.
One thing I want to add is, we're talking lots about this locking up the joint. I don't want you to go out and think that every time I lock up my joint, that's bad and that's dangerous. It's just we don't want that prolonged. The joint can handle it, but we just don't want it to handle it for a long period of time over time. So it's just, if you catch yourself, your knees are locked out, it's not the end of the world. Just try to be mindful of softening those knees, leaning a little bit forward.
Use that excellent interoception to correct those when you remember it.
So a lot of the stuff we talked about kind of just around day-to-day living, sitting up, standing balance. This can also be applied to things like resistance training, exercise classes, Pilates, any other activities you can think of. Let's use an example of someone who suffers from hypermobility in the shoulder. Oftentimes they'll go to an exercise class and the instructor or themselves will say, okay, I'm going to warm up. People hear warm up, they generally think of, I'm going to do a couple arm circles, I'm going to do some light stretching. For people who are non-hypermobile, this may work, but for people who are hypermobile, we want to kind of do the opposite. We want to activate those stabilizing muscles. We want to prime the body for movement so that when we do go into those end ranges with weight or resistance or whatever you're doing, that the body's ready to stabilize that joint and keep it out of that end range and putting stress on the joint capsule. So super simple example of this would just be doing isometric exercise against the wall. For those who don't know, isometric just means you're doing a muscle contraction where the joint or limb is not moving. So Alana can show that against a wall and just do external, internal rotation.
Yeah. Yeah. So if I get in my like handshake position and I brace, I'm solid on the wall, I'm going to push this way as if I'm trying to push the wall over. I'm obviously not going to push the wall over.
It
And then
looks really boring. People
back
wonder what you're
off
doing.
of it slowly.
Yeah, and backing off it slowly. all she's going through here is kind of waking up the big muscles and also waking up some of the stabilizers around it. Like I said, kind of priming the body for movement. A lot of times when you're here, you need to stabilize yourself. It can be like really overwhelming. You're wondering if you need to go to the gym nonstop and you have to be doing this stuff nonstop. It can be just simple stuff. You can apply this to if your hips get sore getting out of the chair. You can do the same sort of thing. Isometrics, inward, outwards, just help prime your muscle, prime your body for movement. Anything you want to add for that?
I do a lot of this stuff while I'm doing other things. So I work on my balance when I'm putting my shoes on, or like when I'm getting dressed. How long can I stand on one leg while I like get something to put on? I do this. Did I already say brush my teeth? I do this while I brush my teeth. If I'm making a cup of coffee, I'll stand on one leg while I make that cup of coffee, and I'll try to notice, where's my knee? Do I have it locked out? Oh, let's bring it back to a little bit less. And then I'll try and hold it in that position. So I just try to work this stuff into my day to day because we all have busy lives, and adding one more giant thing is like a stressor, right? So if we do these little changes, they really build up quickly, and it can make a huge difference in reducing pain as well. Or improving your strength gains. Like that can be a challenge for hypermobile people as well. We tend to not get strong as fast as other people do. So stabilize your shoulder and then do your bench press. Your bench press is going to be stronger. You can lift more. Do some proprioception work, and then do your exercises. Yeah.
And a lot of times people see all this stuff and they want to jump in, they want to do it all, especially with hypermobile, especially if you're experiencing chronic pain. It's kind of slowly adding this, it's slowly building up, getting your nervous system used to it, instead of throwing a whole bunch of it at once, adding more to that threat bucket, stressing everything out.
Yeah. I want to do a little bit of nervous system regulation stuff. Do you want to talk about like pain reduction in treatment? So like the sort of common trigger points around the shoulder that then activating the stability muscles can change?
Sure. So trigger points, I'm sure you've heard this before. It's kind of just muscle tightness that can lead to pain referral in different parts of the body. When we go through, so for example, Lana's upper trap here. This is a common trigger point spot, just right here. Yeah. People, when they're stressed, they're anxious, they bring their shoulders up. You also bring this up when you're on your phone, you're at a computer or driving. So nothing you do ever. That trigger point can cause some tension up here. Your shoulder kind of shrugs up. This can lead to pain up into your neck, down your spine, into your shoulder. So by working through spots here, then when we go to do the muscle stabilization exercises, then it's in a better spot that it's not going to freak out and continue adding stress to that stress bucket. Anything you want to add with that?
Yeah, it can go the other way too. So one that often works for me, like I don't know if anybody else here has tight shoulders right now. I've got this line right here that is like, that's a little angry. So here's a test you can do for yourself. Don't overextend your rotation when you do this. This is not a who can go the farthest competition, but just comfortably, how far can you look to the side with no stress or pain? How far can you look to the side? Okay, and then I want you to take your hand to the side of your head and gently use like 15% of your strength, push your head into your hand and use your hand to stop that movement. So I'm not actually letting my head go to the side. Now I want you to gently back off of that so it's not really abrupt. We're going to go the other way. And then back away from that. We're going to go forward and back as well. So we're pressing forward. And if any of this feels aggravating, then you go, yeah, okay, I'm not gonna do that one today, Alana. Backward. And then ease off of that one. Does it feel different to anyone now before you move? Yeah, no, it does to me. Like this is now a little less intense. And then do your rotation. Do you get any farther before stress or pain sets in? Anybody get farther? Yeah, I get farther with that. My shoulder feels better. And the way I think about this is there's a lot of muscles involved in stabilizing the neck and moving the neck. And if some of them aren't really paying attention, the other ones are overworking. That's an unsafe feeling at the nervous system. Your brain is going to limit your movement via pain and tension because it doesn't want you to stress that movement out. Once we wake everything up, and this could be just proprioception, now the brain's paying attention to this, maybe we've turned on some of those stability muscles. the nervous system settles down a little bit, you get better movement. Also, the vast majority of your proprioception, the important proprioception information for your head comes from the muscles in the neck. So when they're chronically tight, we have worse overall proprioception. Yeah. Okay. Does anybody have questions about training stuff? That was a really quick thing. If you've seen either of us for treatment, you've probably had us like, can you activate this for me? Can you slide your shoulder blade down your back and hold that? And then let it go. Is that better, same, or worse at this pain spot that we're poking at? So often, you know, again, the typical massage or typical manual therapy treatment is often like, let's stretch everything out and let's get everything feeling nice and fluid. And I mean, fluid muscles is great, but if it's not helping, and this is often where I work on somebody, I'm not getting change. They're like, no, that's the same. No, that's worse. No, that's the same. That's the same. And then I go, I wonder if they're hypermobile. And I start moving joints around, and even though everything is so tight, I can take their scapula and like, I'm like, okay, let's try activating something. And then we activate it, and then I poke it again, and then I go, oh, that's better. So then I say, okay, whether or not you have a hypermobile condition or just like support muscle coordination around this joint, you will benefit from the tools that a hypermobile person benefits from. So let's treat you as if you are for now. And that can change as well. Okay, so let's talk a little bit about nervous system regulation. A regulated nervous system is a nervous system that responds appropriately to the situation that you're in. So when we say regulation, we don't mean you're floating through life all blissed out and you never get stressed. Stress is important and it's healthy, and sometimes it's the right state to be in the situation that you present in. So please don't ever take like anyone's advice on nervous system regulation to mean that if you ever feel stressed or fear or, you know, rushed, that's a bad thing. That might be perfect for what you're supposed to be doing. That's what your nervous system is great at. But we want a nervous system that responds appropriately. And most of us, especially if we have some hypermobility, we tend to live up here in the stress response instead of in this nice, responsive, resilient stress response. So a couple of my favorite ones, and I'm going to demo this one, and I want to be careful when I demo this one that, again, we're not going to our end range. This isn't how far can I get this, but when we bring our head backward and tuck our chin just a little bit like this and inhale, and then we hold the breath as long as it feels nice, and then when we're ready to exhale, we exhale and relax. What we're doing is increasing the pressure inside the throat. When we close off our throat and increase that pressure, we increase the pressure in the chest cavity. That's going to stimulate your vagus nerve. And your vagus nerve is interoception, it's relaxation, it's your gut-brain axis, it's your anti-inflammatory pathways. So that's a great one, but I don't want people going here because now we're just taxing this stuff back here, which is probably already feeling a little bit fragile. So it does not have to be extreme. And for a lot of us, we tend towards extremes. So I want you to try that. Get in a comfortable position. You're going to slide your head backward just a little bit. Tuck your head down. So we're just doing this little chin tuck, and then inhale. Hold your breath as long as you feel it feels good to you. And then exhale. Drop the shoulders. Let the jaw go. And let's try that again. So head back, chin down. Hold that. And exhale anytime you're ready. Does that feel different to anybody? Better, same, worse? Did it stress anybody out? Did that hurt you? Yeah, okay. I do this regularly. I do this every day. When I'm very dysregulated, my heart rate gets quite high. I don't have POTS. I'm just stressed. It's the hurry and the like, I have too many things to do. So easily my heart rate can be 120 when I'm just getting ready to leave my house to go somewhere. 10 breaths like that usually drops me 20 or 30 points. Yawns are good. Yawns are a vagus nerve response. That's a great thing. Yeah. You're stuck. No, I mean, I can barely talk about this without yawning because I do a lot of this work. Another one that I want to show you, and this is one you can do seated or you can do it laying down with some pillowing, but I want you to try this so you can feel what this feels like. Again, no maxing out your end ranges, but I want you to curl. I'll show you this first. I'll show you it standing. You're going to curl forward in your chair like this, and then I want you to take a full breath, and you're going to see where that feels restricted. And then I want you to do the opposite carefully, extending backward like this, taking a full breath and seeing where that feels restricted. I only want you to go as far as it feels safe for you to go. So this can be as easy as just punching like this and try and take a full breath. And notice where that feels like, okay, that's all I can get. Let that one out. All the way back as far as it's comfortable. And let that out. To me, both of those feel restricted, but they feel restricted kind of in different ways. Okay, what's a really great position for your rib cage and your thoracic spine and your nervous system is with your hips neutral, your sternum lifted just a little bit. So everyone's yawning. I love this. It's not because we're boring, it's because you're relaxed. So your hips are neutral, the sternum lifts just a little bit. Now try taking a full breath. And let that one out. Does that feel different? Yeah, maybe, no, it's okay if it doesn't feel different. What I like to get is a position where the lungs can move, the ribs can move, the diaphragm can travel. And so we're getting really good quality breathing. We're also getting stimulation to our nervous system because your vagus nerve sends right through the middle of your diaphragm. So when the diaphragm travels nicely, it should be stimulating to that nerve. And at the same time, it's sending a signal to your nervous system. If I can breathe fully and my lungs can travel, or my lungs can inflate, my ribs can travel, I can't be having an emergency situation, right? If I'm not running, there's no fire. The other one I really like to add to this, and this can be incredibly helpful for people who have unstable ribs, is I put a little bit of pressure on my rib cage. So I hold my ribs in, and when I inhale, I try to push my ribs outwards into my hands. And when I exhale, I slightly compress my ribs in a little bit so I can feel some change. I inhale, pushing my ribs outwards. I usually get more travel on my second inhale and down again. And this is one I do regularly on the massage table when I feel like, ooh, this rib cage is really stuck, or the diaphragm's not traveling through, or this person's breathing way up here using all of this accessory muscles. We're getting increased proprioception. We're maybe waking up the stability muscles in the rib cage. So the ribs actually feel more secure, which allows the rib cage to travel in a way that doesn't feel scary to the nervous system. So this is one I regularly do on the table. I do it at home with a pillow. I do it seated. I do it standing. So that's a nice one to both get your nervous system engaged, but also get that benefit of proprioception. And for most hypermobile people, we're really mobile here, and we're really mobile here, and we're way less mobile through our thoracic spine. And sometimes, ironically, increasing the mobility of the thoracic spine allows the back and the neck to chill out because they're not doing all of the mobility work. You can use scent, you can use vision, you could use taste. I guess I don't do this in the massage table. Just bite on this lemon while you're in the middle of a massage. It would work, but it would be weird. Not weirder than some of the other things I do, probably. But any of your senses, anytime we are getting really good quality information in through our senses, that informs our nervous system accurately what's going on around us. And it also actually forces our brain to bring the blood that's hanging out here in our survival zones. It forces the brain to send some of that blood up to the higher regions of the brain where we do sensory integration or motor control. And we can get a regulated nervous system by using our senses. I have one more I want to show you. This one is, I think it's a fun little challenge, but we're going to try this. What I want you to do is take your dominant hand and put it on the palm of your non-dominant hand. And I want you to flip your hand back and forth as fast as you comfortably can. Now I want you to try the other way, non-dominant hand flipping back and forth. Is that harder for anybody? Yeah, okay. Now I want you to take this hand and I want you to friction it on the chair or the clothes that you're wearing. I want you to like stimulate the skin all over the side of this hand. You could even like use your nails and scratch that, keep going for like another few seconds, get like to the seam or something. Ooh, look, I've got my balance. Okay, now I want you to try again. That's easier for anybody. Now some of you are like, no, it's much easier for me. I've trained this before. Okay, yeah, yeah, exactly. So all we're doing there is stimulating the skin in the area that we want the brain to pay attention to. And that changes the way that structure works. You can do this anywhere on the body. You're like, man, that knee is so gross feeling. You can like grab a washcloth and like friction the skin all around the knee and then try your movement again. And the brain's like, oh, that feels a little better. Okay. Complex hand movements. Now I'm just messing with you. This is just fun. Okay. Fist, flat hand. Okay. Some of you can't even do level 1. Okay, fist, flat hand. Now we're gonna switch these. I practiced this, so I'd be good at it. Okay, this actually, so this activating your motor cortex activates your thinking as well. This activates your cerebral cortex. And then you can go like, this one's hard. There's a lady I follow on Instagram that's like, do a peace sign and a rock on and count with the other hand. And but something like this will actually regulate your nervous system, right? Because now all you're thinking about is what's wrong with my hand. But like, this is a complex movement task. There's studies on this that show that this reduces dementia and Alzheimer's. Okay, not this specifically. It doesn't have to be just, if you can't do this, you might as well just phone it in now. But doing complex movement tasks, and you can give people exercises for this, is great for the brain, and it reduces inflammation. And yeah, if you're worried about Alzheimer's and dementia, the other things are stress reduction, sleep, nutrition, hydration, movement, social engagement, and mental stimulation. So tonight, bang on. Baby's drinking water. We're good to go. Okay. Does anybody have questions on any of that nervous system regulation stuff? My advice is, and what I know about the nervous system is, our nervous systems we developed our nervous systems when we were Neanderthals. Okay, hunter-gatherers living in social groups. We're very good at Neanderthal style stress. Short and direct. We know it begins, we know it ends. We are not good at big, overlapping, chronic, all the time stress. Neanderthals did not worry about hypermobility. Okay, like they just died. And like, of all of the things that we worry about in our chronic stress, like this is not a thing that our nervous systems are built for. So anytime we can inject more resiliency into our nervous system by giving ourselves breaks from that, I'm living up here and I got to just dip down a little bit. I might go right back up there. I'm going to dip down a little bit. This allows our nervous systems to regain some of that resiliency that we should have. So small breaks actually matter. And I know it seems like that's not enough, right? The overwhelming amount of stress. Okay, I'm going to breathe like that twice a day, Alana. Awesome. I promise you it helps, it matters, and it adds up. Same with, I got a break from my chronic pain. So I did whatever it was that was helpful for me, and I had a half a day where I felt pretty good. It sucks when it comes back. But the fact that you had that break gave your nervous system that like less threat in the threat bucket for a little while, and all of that stuff matters. So I know it's a much bigger problem than just these little tips and tricks. But we also wanted to give, like, this is a little picture of what working with a really good manual therapist can do. Can I just say, don't go anywhere. Like, if you go to see a chiropractor who cracks you and sends you out the door without assessing you and seeing whether it's better or worse, do not see that person again. If you go to see a massage therapist who sticks their elbows into your whatever you say is sore and sends you out the door without checking to see whether it felt good to you or you feel any better afterward, you feel any better the next day or the next day, don't go back. On the other hand, if you have somebody you see who makes you feel better, even if they have no idea about hypermobility, that's okay. As long as it's working for you, that's what really matters. And a lot of manual therapy is actually about rapport anyway. It's about you trust the person and you like them. So if you're getting good results, keep doing that.
One thing I'll add on that, in kind of more chiropractic focus, is I get lots of people asking me, should I be adjusted if I'm hypermobile?
No.
The answer to that is it depends. So, as Lana was mentioning, oftentimes there's hypermobility in your neck, hypermobility in your lower back. To compensate for that, sometimes your mid-back gets really stiff, gets really stuck. In that case, an adjustment in your mid-back may be helpful, it may not be helpful. Obviously, we're not adjusting the joints, the areas that are already hypermobile. That's not great, but other areas often compensate for this hypermobility, and they can use the help. And yeah,
there's a lot of debate about this in the hypermobile community. The overall recommendation is no spine adjustment for people who have a, congenital or overall hypermobile condition. But there are a lot of people out there that are like, when I get adjusted, I get a week-long break from my migraines. So I'm definitely getting adjusted because it helps me and it's never been a problem for me. But what I really care about is your chiropractor actually knows that adjusting you somewhere could be risky, you're gonna, is at least gonna ask you, like, has this ever been bad for you? Does this feel good? Is it beneficial? And then there's all kinds of joints that aren't the spine that might benefit from adjustment as well, that don't come along with the risks of adjustment. So it's really, I think, about knowledge on your practitioner's part and your ability to say, I do not like that, don't ever do that. And your practitioner says, yeah, okay, we're not gonna do that. So that's our spiel. And be careful with your body and don't let people do stuff to you that doesn't feel good to you. Okay, pretty sure we didn't forget anything. Just checking through it. No, that page is blank. We must be done. So we're gonna leave it there. If you have questions, please feel free to hang around. We're happy to chat with you and answer some of those questions. If you want to chat with Donald about the study that's going on, you're actively recruiting participants now,
Yes.
right?
Yep.
People need to have a diagnosis or no?
No.
Okay, so you don't have to have a diagnosis, which is good, because probably nobody does. But you guys run through a criteria of, you meet criteria for a certain amount of hypermobility or not, so. And some of these studies are a really fantastic way, not just to give back to science, but to learn about your body. You learn a lot from being a participant in the study usually. Okay, thank you. If anybody wants a recording of this, based on my overall memory tonight, I highly recommend you email me to ask for a recording and then I will send you one. And for those of you online, I've already got you on a list of, we're gonna send you recordings. So we will do that as soon as we have it, you know, functional and as long as the audio quality is reasonable and all that kind of stuff. Yeah, okay. Thanks for coming. Feel free to ask questions if you've got them, if you want more private, that's all. Yeah. It's been a minute. Yeah. Yeah. Look forward to it.
My wife,
I-
sorry, Tim, my wife Jen comes to see with her stuff, and then he says,
Not
just
negative.
can't stop saying that I can.
So.
Made a lot of progress.
Oh, yeah.
On that.
Yeah, I mean, just, you know, words.
Right now, we're limited.
Yeah.
Yeah. But she's really
We know what
thankful
affects
for you,
people,
so I appreciate it.
So,
But yeah, I've been, since I was a little kid, chiropractors. I started out with an S spine when I was a kid, so they kind of straightened my hips for crooked. Yeah. Man,
Yeah, exactly.
yeah, yeah, because they used to like.
Okay, I'm gonna end this meeting.
So just.